has recorded over 16,000 new COVID cases in the last 24 hours. The death toll, the reconciled figures are 54. In fact, a few days ago, India reported close to 70 deaths. The deaths have also increased. The cases are also increasing. In fact, Priyanka Gandhi Vadra has tested positive for COVID-19 once again, and so have other leaders of the Congress party, like Mallikarjun Kharge, for example. She joins the long list of people in Delhi who are once again getting reinfected with COVID-19. Delhi continues to record over 2,000 COVID cases. It has done so in the last 5 days or so. The increase clearly appears to be very different from the kind of surge or minor spike that we had seen in the month of April. Delhi's positivity rate is hovering around the 17% mark, which is actually the highest since the 21st of January earlier this year. Deaths also have increased in the country, like I said. In fact, since the beginning of the year 2022, over 45,000 deaths have been reported in India due to COVID-19, of which Kerala has recorded the maximum number of deaths. In fact, Kerala accounts for more than half of the deaths that have been reported in India in this year alone. In a new development, Nepal has also banned the entry of Indians into its soil. The reason? 4 Indians travelling to Nepal were found to be COVID positive. So what really is going on here? Should we be bracing for a new wave of infections? Here's what experts say.
India's genomic sequencing has not identified any new variant. The INSACOG's regular bulletins have only shown what is expected. That is a gradual rise in BA5 at around 15% of what is prevailing right now. That percentage will likely increase as it's doing in other parts of the world, but it is not likely to cause more severe disease as is feared elsewhere.
This is unlikely. A 4th wave of infections and the kind of surge that we had seen in the Omicron wave of the infection is highly unlikely. Let's talk about the national capital first, and also the national capital region where cases are increasing. As far as Delhi city is increasing, the concern is that there is a slight increase in hospitalizations here. 51 patients as of now are in Delhi's LNJP hospital. Doctors here say that 14 to 15 cases are coming in every day. Doctors, however, are taking solace from the fact that the need for ventilators hasn't really gone up, which means that the severity of the infection hasn't increased much in spite of the hospitalizations. The Delhi government says that most cases are mild and that the situation is under control. Experts, however, say that this is the time to get in protection from the booster doses.
There is clearly a decrease in infection in the 3-dose group because we know that the protection against infection given by any vaccine dose is short-lived.
The concern as always is that the numbers that we're talking about in terms of cases and in terms of deaths is going to be an underestimate, given that there are many people who are either not reporting the symptoms or not testing or using the home-based antigen test kit and are not doing the regular RT-PCR test. Many of them are not even testing. A survey by Local Circle says that 9 in 10 Delhi NCR residents with symptoms of COVID-19 are missing from officially reported case figures as they skip taking the COVID test or opt for at-home antigen test. Of those who had COVID symptoms in Delhi NCR in the last 30 days, only 12% of them took an RT-PCR, while 63% of them chose not to test at all. About 33% of those people with symptoms had taken the RT-PCR test in the month of April when Delhi was seeing a surge. That number has actually dropped to 16% in June and 12% in August. So whichever figures we put out for our viewers, do understand that this is an underestimate. COVID is very much here. It hasn't gone away.
For more informative videos like this, keep watching India Today News Mo.